Okay, so we just did this, yes?
Mm-hmm.
And then I want you to come to one side and transition like this. Okay? And what we're going to do from this position is the hand closest to the head. We're going to engage the musculature of the gluteals. So we're doing this palmar compression, this fist compression in between the border of the sacrum and the greater trochanter. So we're going to, as I lean in, I bring the leg across like this. And you're going to work all up against that border of the sacrum. And you notice points of contact, extended arm, just lean in. And then after you loosen it like this, you're going to come and bring your knee in and do the same thing. Pressure's okay? As you lean in, you bring the leg across. When you bring the leg across, it brings the musculature up to the surface so that there's a clearer engagement. Do that a few times. And then also bring, with the knee engaged, bring the leg back. Oh, baby, see, she's trying to tap out now. That's a whole different thing. You want to keep the musculature engaged and then bring the leg back. It's very nice. Loosen the hip like crazy. So then, from here, you come up like this. Just relax. And then swing the leg a little bit to loosen that hip that you just worked on. And you're also lowering it down straight so that this compression, we're going to compress in here now. So now it's engaging very well. And you're going to take the knee that's closest to their feet and start just below the ischial tuberosity and lean in. It's a really nice way of working the hamstrings, the bladder meridian. This other hand is here for stabilizing your body as you're working. Leaning in on the exhale. And we're going to transition into the lower leg. So we come down and we lean in and stretch. Lean in and stretch, and as we're stretching, we swing our body around. And this comes right here, and then we're going to lean for traction. Now, if you remember about the bladder meridian, as it comes into the lower body, it's just underneath the ischial tuberosity, straight through the gastroc. It veers laterally in front of the Achilles tendon and behind the lateral malleolus and right into the side of the foot and out the little toe. So coming up, we're going to use thumb pressure to compress right into the bladder meridian. And then you're going to come, here's the knee crease, and you want to just do some nice circular friction here to ensure that not only it loosens the soft tissue, but energetically, the energy has a tendency to get stuck in the joints. So you want to make sure that along with the traction and the circular friction helps allow the energy to more readily pass through the joint. Squeezing the gastroc. And then you're going to compress right in between the bellies of the gastroc here, right in the center. This is where the bladder meridian is. And as it comes down, you want to veer laterally in front of the Achilles tendon. Here's the Achilles tendon here. So the meridian comes through the belly of the gastroc, and as it turns from muscle to tendon, which is in this case the Achilles tendon, you veer laterally with your pressure in front of the Achilles tendon, but behind the malleolus, and right into the side of the foot, and right out the little toe. That's good work for the bladder meridian. And then you're going to bring the leg up and put it in figure 4. Stabilize, and you're going to swing yourself around. And you'll see on the replay. So the knee stabilizes here, both of my feet come up. Now I'm on this side, and I'm open because I'm going to use my forearm, go right into the gluteus. So just work that area again in between the border of the sacrum and the greater trochanter of the femur. And then I'm going to palmar compress into the leg, gallbladder meridian. Remember the gallbladder meridian that starts on the side here, the face comes down through the hip, through the iliotibial band, and in the lower lateral compartment of the leg it goes right through the peroneals, and right in front of the lateral malleolus, where the source point here in front of the lateral malleolus, gallbladder 40 is, I'd like you to address that. And then a line right into the dorsal surface of the foot and right off the fourth toe. And then for the final stretch, you're just going to use your body weight and bring that knee to the midline. You're going to come up, and the foot closest to the top of their head goes in the small of their back. This is very light pressure. The arch of your foot spans the lower lumbar vertebrae, so you're not directly putting pressure here. That you're not on the sacrum, but above the iliac crest. That you're going to bend, not at your lower back, but at your knees, grabbing a hold of the foot. You're going to inhale, and on the exhale, just think about standing up straight so that they get a nice stretch. The stomach meridian is also a very good psoas stretch. You can do that a couple of times. And as you lower down, you follow it down. Knee touches, your knee touches, foot comes down, and then you immediately just scoop this other one up, and you do the same thing on this leg. Okay? Okay, thank you.